Good morning, dear Chairman and dear President of the Academy and the Foundation, dear Professor Laurence. And it's really a great honor for me to be here to share our experience to how to build a cardiovascular service network in China. So actually, I've been trained in Paris for 2 years and then went to US for 6 years. So I returned to China as a young surgeon at the age 30s, how to use the Western trained technology and the idea management to break into a Chinese system. So it's challenging for me. So it's a story about how we, So actually, we're in the very fast reform stage, healthcare reform stage in China. So we have a very good new policy, Chinese government support to encourage the capital market and open private practice into the healthcare system. But also in this system, actually, we have a big imbalance and the lack of resources. And it showed that there's a relatively surplus of the resources in the big city, and about absolutely shortage in the small town and the remote rural area. So that shows that we have most of the big hospital, most of the physician is concentrated in the big city, but the patient in the countryside cannot receive this service. So this is a good opportunity for us, to how to change the type of education, training, and the system. So we call it, we need to build a new system called private physician system. So this new private medical system shows the importance to optimize the usage of land, equipment, human resources to improve the social and the economic benefit, and also to relieve some difficulty and the cost of the medical service. So patients can receive the advanced technology in the nearby home, actually in their doorstep. So also can benefit the hospital to train their staff and use the latest technology and the clinical service development. And so to building a normal relationship between the hospital and the physician, to building some legal protection, logistic support, and business financial management. So also for our physician to we have more opportunity for physician and have a better personal career. So of course, we face a lot of confusion and dilemma in China. So we have a good policy, but there's no details how to do it. And the big difference and the unclearness between the province and the different region. So the government have not enough financial support, but we have a lot of money in the private sector to seeking the opportunity in the healthcare system. So, there's actually marketing and the commercial management for healthcare is still immature, unexperienced in Chinese market. So what do we think? The competition for the hospital is many, you need to have a well-trained staff with top technology. So how to do this? How we can change? We change the patient service system. We change doctor, pharmaceutical company, or insurance company. How to do this? So actually, in Chinese system, the insurance company, the payer can only pay hospital, not pay doctor, not pay doctor company. It's illegal to pay doctor directly. So that's just the beginning for the commercial insurance system in China. So how to do it? So in the many conference, our group said we based on the patient-centered policy. The government will change to try to change reform the policy. The government will open a platform for physicians, for the patient, and we need to free them physician, because the old time the physicians is full-time employee for the public hospital with no private system. So our idea is no waiting, no shanking, no complaint. So we action quickly do our best to build our own system. So the Sino-Heart group is one of the largest private cardiovascular service company, so consists of almost 100 physicians, nurses, management team together. So we start this business from 1996 when I come back to China from US, finish my US training. So we used the latest technology. We did the first off-bump coronary artery bypass, minimum invasive mid-cap. It means in the old time, we do the open heart surgery, need a heart lung machine. The heart need to stop. So we don't need a heart lung machine. The heart in the continuous beating stage, we can operate on the beating heart, normal heart. So this will cause less complication, less risk, and benefit the patient with cost less. So the brief introduction about Standard Heart Group, we working on totally 15 hospitals in 20 provinces. The type of cooperation we call technique support, management contract, and the joint venture program, so all around the country. So this is one example for our first joint venture program in Qingdao Star Hospital. I think many of them you know the name of Qingdao because the famous beer called Qingdao beer. So that's in Qingdao City. So we start the first program there in the second People's Hospital with on the contract base. And then we form a company, form the independent hospital in 2000. So there's three types of model of cooperation. We call technical support and the management contract and the joint venture independent hospital. So in this hospital, we achieved a lot. We did the first, we call up-cap surgery in Shandong province, the first mid-cap and the first many of the new technology in this province. Also, we use this hospital as the headquarters for our system to help people in the other province. So we received the first grade prize from the National Education Commission. So current status of market shows we have almost 3 million myocardial infarction patients and 2.2 million rheumatic valvular heart patients, and the congenital heart patients about 2 million, and 1.6 million of cardiomyopathy patients, which is totally more than 80 million patients may need open heart surgery. So what we can do? Currently, the situation in China, we have more than 800 open heart programs. We can do 250,000 open heart cases. The largest center, which means doing over 1,000 cases, is less than 30. So we can only reach less than 5% of demand. So there's a huge market and a big opportunity for the medical society. So what we can do is to build a new business model we call the private physicians group. So in our group, we will plan to sign the contract with more than 500 physicians to manage 100 centers. So Standard Heart Group is our key promotion issues with top team and new technology, and using international standard patient care, advanced management, and the national network, and we share and exchange the human resource equipment data. So for example, if we want to build a hospital can perform 10,000 cases, actually we have 2 hospitals in China can do 10,000 cases per year. So we need to invest 2 billion RMB. But if we can sign a contract with 50 centers, each center doing 200 cases, we can reach the same number. What do we need to invest? So invest is only 0.1 billion RMB, but what we need is really the advanced management. The good management is the key issue. So we use the innovation technology and the new device, where actually we learn, from the Western country how to promote the service in China. So we started this in 1996. We do the first cases, number of the new technology in China. So this is some kind of stabilizer. When the heart is keep beating, so we use a stabilizer and make the local coronary is stable, relative stabilizer. We can sew in the vessel and then finish the case. So without a hardware machine. So that's a different device, and of course, the early small company was purchased by the big company, Medtronic, Guidon, Jinzhang, many companies. So there we have many devices available. So of course, in order to control the cost, we reuse it, sterilize it. So now it's forbidden to do this. The government don't allow to do this anymore. So the second area is called for the heart failure disease. So using advanced ventricular assist device, we call it artificial heart. There's many devices available, which I learned actually in 1998 to 1990. I trained in Paris, the Henri Mondor and Professor Loisans here. So we did, after I come back to China, I did the first VAD in China and the first transplantation in Peking University. So we formed a new heart failure committee, and we're doing some research and the Chinese training system and the Chinese device. So this is some picture show my training process. I was young, 27 years old at that time, 30 years ago. So this is in the Henri Mondor, I working with Professor Loisans. He's also younger too here. So this is back to Qingdao. I did the first case ventricular assist device implantation with an American surgeon down here together. So this is a VAD, and the first left VAD in Beijing. So we use the same device. This device, the control system costs 3 million RMB, but it's not affordable for every hospital. So we use the device. We're traveling to different places to help people, on demand. So we charge the local the patient at the hospital. So the one machine can use in many areas. So have a very efficient economically. So the patient, this is a patient after 5 days remove the device and survivor. So this is shows different devices in China, but of course all the devices now is not registered in China. So we can no longer use any imported device in China. So that's a big opportunity for many companies come to China for the heart failure therapy. So this picture shows the network in China will start Post Telecom Hospital in Beijing and the Shandong province and the Henan province and the Changzhou city and many places in the southern China. So I'm the founder and the chair of the Chinese Association of Cardiovascular Surgeons because the achievement and the network and the service in China. So this also we went to Tibet, so operated the open heart surgery in the highest place in the world. So for the charity program. So we established this network all around the country. So sharing the technology and the idea and the building the bilateral win-win situation to help local people. So we have a training program for the physician, for the patient's family, and we read the book and the magazine, and also a celebration in Mongolia, Inner Mongolia. So this way working. Also, I working with Professor Loisans in Burma as a charity program. I go every year and for continue 10 years in Burma. So there's 10 years ago, and from Yangon and the Mandalay, we operated on the monk in the Mandalay General Hospital. So with this team, we start from the 1996, and we formed a private company, and most of physicians have Western training and experience background, and we want to working together every year. We have a meeting together. I'm honored to receive the membership of foreigner in the National Academy of Surgery of France in the 2013. So this also shows our network around the country. So that's our team. And we also have an international training program for the cardiac surgery and for the heart failure training, wet lab, and all kinds of also Professor Loisans and the surgeon from the US, from the European, all gathering together to this kind of training program. So training is important. Innovation is, it's very important. So, and that's all we've done. We standard group, so it's concentrated as a physician together, and we're building our own hospital, own network, on the research institute, and the investment company and the supply company work together to try to establish a national cardiovascular network in the country to save more people, save the poor people around the country. Thank you very much.